I am Dr. Laura Holmes. I'm a physician and I am board certified in undersea and hyperbaric medicine as well as family medicine. I recently joined the St. Luke's Wound Care and Hyperbaric Center as medical director. I received my MD from the University of Alberta in Canada, and then I received more training there and at McGill University in Quebec. And we emigrated to the United States, my husband and I, in 1996. And came to Missouri in 2000. We've been here ever since. I specialize in hyperbaric medicine as well as wound care medicine, and that means that I look after people who have wounds and problems that are not healing properly. I think that patient care is best when it's a partnership between the patient, their physician, and the patient care team. There has to be a communication and an understanding that everyone has a part to play, and it is a definite team approach to healing wounds. Everyone has the same goal, and everyone has a job that they are responsible for. And it requires a large number of people compared to what you would see in a normal doctor's office. Hyperbarics is a treatment that involves the patient breathing 100% oxygen at a higher than normal air pressure. This is not a fast process. It's a treatment that takes about 90 minutes each time, and it can be once or twice a day, and it can be for 2 or 3 months, although it isn't usually that long. Hyperbaric oxygen therapy is the breathing of 100% oxygen by a patient at a greater than air pressure. So we're not at sea level, we're more at 30 feet of water equivalent. Now, we all call it diving, but we don't put people in water. What we have found with this is that we can put oxygen into the blood at a level that's far higher than you can obtain by breathing it normally through a mask or by putting it on the skin topically. Oxygen at pressure works as a drug. It is known to inhibit the growth of some bacteria. It also improves the function of the white blood cells in our body, and it can affect the growth of blood vessels. It stimulates the growth of blood vessels. We've also found recently that hyperbaric oxygen or high pressure oxygen therapy will activate a patient's own stem cells. This is some of the mechanism by which it helps wounds heal. We use it for many different diagnoses, but some of the more common ones are severe diabetic foot ulcers, vascular ulcers, meaning that a patient doesn't have enough blood flow to their legs or hands, and it's used for that. We also use it to treat bone infection that has not responded to standard therapies. Hyperbarics is very safe. The procedure itself has less risk than if we are doing a exercise stress test for a cardiologist for your heart. However, the patient themselves may have contraindications to the treatment. It is pressurized, and so you have the problems of clearing your ears, for instance. You have to be able to get your ear pressure to be the same as the pressure around you. And if you've ever gone over a hill in your car and noted that your ears plug up, that's kind of the effect. That's one of the side effects. So you do have to be appropriate for the treatment. The other thing is that some people can't make the time commitment. If you have other medical therapies that interfere, if you are not well enough to undergo a 2-hour treatment, then that would make it less likely that the hyperbaric therapy would work for you. St. Luke's has a wonderful wound care center. The staff has excellent training and skills, and they're very good to work with. It has a really good atmosphere, and I've been enjoying it.